according to the book Oral and Maxillofacial Surgery Secrets, nearly 85% of adults have their wisdom teeth removed to protect their oral health. With these odds, it's likely that you'll encounter an oral surgeon in your life. Oral surgery is a very important field because the mouth is the window to your body, which means that your oral health is a lot more important than a lot of people give it credit to be. I have had the privilege to work for two of the most renowned oral surgeons in the Midwest as a surgical technician and an assistant. So today I'm going to inform you about what a career in oral and maxillofacial surgery is, what they do, and the schooling and requirements needed. So to start, we're going to talk about what an oral and maxillofacial surgeon does. They are regional specialists dealing with the mouth, jaw, face, skull, and associated structures. So they do a lot of procedures. The most common one that you guys probably know is wisdom teeth extraction. They can do it because it is impacted, which means that it's pushing against other teeth, or because it's infected, or a lot of other reasons. They also do facial trauma. That can be anything from fights to accidents. While I was in the office, I actually got to experience a facial trauma surgery. A guy was hanging up the telephone wires and one of them snapped and completely shattered the left side of his jaw. So the oral surgeon had to come in and debride the jaw. He had to wire the jaw shut, and then after about a year, he should have full functioning of his jaw, which is pretty amazing because without the oral surgeon, he probably would have never been able to open his mouth again. Oral surgeons also diagnose and surgically treat head, neck, and oral cancers. Our family actually had an experience with this as my dad had a tumor up in the roof of his mouth in 2010, and the oral surgeon ended up removing it and fixing the whole thing, and he is now cancer-free, and his mouth is completely back to normal. Oral surgeons do have a wide variety of other procedures that they do that can include cleft palate and lip surgeries. They can do temporomandibular joint surgeries, that's the joint that moves your jaw. They can do corrective jaw surgeries and dental implants, among a lot of other things. So with all of these cool procedures, I bet you guys are wondering about how long you would have to be in school. The answer to that is a very long time. They have 4 years of undergraduate. Once they get through that, they're going to have to go to dental school. That's 4 years of continuous, non-stop, spring, summer, and fall. You're going to do a little bit of clinical, a lot of books, kind of a combination. Then after that, you're going to be a licensed dentist, but you're not done. You're going to have to go to an oral and maxillofacial surgery residency program. That's 6 years. You're going to do medical school and the residency where you're going to work just with the mouth, head, jaw, neck region. So that, if you lost track, is a grand total of 14 years after high school. So that is a lot of school. You're going to have to enjoy school, and Dr. Prawl, a general dentist who has practiced for over 20 years, he's worked side by side with a lot of oral surgeons, and when I interviewed him, he said oral and maxillofacial surgeons are the most trained professionals as they have both a dental and a medical degree. So after those 14 years, you're actually not done. You still have to yearly do tests to remain certified. And so Louis Rafito, he's the president of the American Association of Maxillofacial Surgeons, and he practices, he said that you have to have a commitment to lifelong learning. The surgeries will stay the same, but the way we do them will change. So if you want to go and be an oral surgeon, you're going to have to love school, and you're going to have a passion for changing lives. So a positive to all of this, though, is the salary. The U.S. Bureau of Labor Statistics said that in 2016, once you have been established, you can make up to, well, the median wage is about $260,000 a year. So that is a lot of money, but you also have a lot of school. So oral surgery, as you guys can see, has a lot of benefits and drawbacks. It has a lot of schooling, but with all those procedures, you can do a lot of great things and change a lot of lives. So oral surgery, as you can see, is really important. They do both preventative and corrective surgeries, and with that, you're probably going to have to encounter one in your lifetime. So the next time you encounter an oral surgeon, whether that be arriving by your car or by the ambulance, be appreciative of the work they do, because you know that the road was very long, but the work they do could save your life. Thank you.